Attention eye care professionals. Discover the Oculus Charactergraph 5M, a 3-in-1 powerhouse offering meibography, tear breakup time, and topography. Capture high-resolution images to diagnose dry eye disease, educate patients, and boost treatment conversions. Learn more at oculususa.com/dryeye.
As much as we've learned about ocular surface disease, there is still so much yet to be discovered. The good news is, this creates a world of opportunity for eye care providers.
The goal of this podcast is to better understand this chronic and complex condition and keep you up to date on the advances being made in its diagnosis and treatment. So let's get to the point. Welcome to another episode of the To The Point podcast. My name is Jackie Garlich, and I'm joined by my co-host, Jessilin Quint. Hi, Jessilin. I'm seeing that you're in another hotel. I feel like that's where you live.
You know, story of a woman on the go. We'll call it that. But it's been a busy year. But yes, coming at you from another hotel, racking up those Marriott points. Got to cash them in at some point.
Like, do something fun with them. I feel like you're doing business things with them. That's it.
That is true. That is true. I haven't used any yet, so I'm just collecting them from the business. So I will have to do something fun. But it's good to see you, and hello to all of our To The Point listeners. And we have an exciting guest. Jackie, tell everyone about who we have on this exciting episode.
Okay, Jessilin. So this is a very special episode because we have never, in the 4 years of this podcast, covered the topic of Meibomian gland probing. And this is a somewhat controversial topic that deserves a good conversation. And recently, Jessilin and I saw that Rana Taji was giving a lecture on this at Academy, and we thought we have got to bring her on this podcast to talk more about that. So let me tell you about Rana. She is the owner and medical director of Toronto Medical Eye Associates in North York, Ontario. And I'm sure you've seen her on the podium. She is a frequent lecturer offering subject matter expertise on dry eye disease. She serves as an adjunct faculty clinical supervisor for student doctors from the US and Canadian optometry schools. And she's been in clinical practice since 2010. She obtained her OD degree from the Michigan College of Optometry and her fellowship in ocular disease from the American Academy of Optometry, of which she is an active member. And she's so fun to talk to and hang out with. And we're so excited that you're here, Rana. Thank you for coming on this podcast.
Thank you so much for having me. It's been so much, it's such an honor to be on here.
We're so happy you're here.
Yes, another dry eye expert, and just somebody who's as passionate about dry eye and the ocular surface. I feel like it's just so fun to talk shop. So we're definitely excited you're here.
Yes. I think Meibomian gland probing is, it's not something that I do in my practice. Jessilin, do you do it?
I don't do it, but I'm excited to pick our guest's brain because it is something I want to learn more about. So I'm very intrigued by it, but currently not doing it.
So, okay, let's maybe start with that. So Rana, can you talk a little bit about what Meibomian gland probing is? Like, walk us through this procedure of doing this to a patient?
Yeah, so probing is a procedure where a small 76 micron diameter tube is inserted into every orifice of a meibomian gland in order to clear any possible obstruction that is otherwise known as periductal fibrosis. And this is essentially scar tissue. There is a hypothesis that a subset of meibomian gland dysfunction is obstructive and that's not able to be cleared or alleviated through our traditional methods, whether it's thermal pulsation or IPL or any other tools that we have in our toolbox. So, in all of our practices, I'm sure we've seen a percentage of patients that are just not responding to our traditional conventional treatments that we've had. And we often wonder what's going on and why is it that they don't respond to these treatments. And so when I started to dig deeper and I found probing, what I discovered is that based on the inventor's hypothesis and his deep dive into how large of a percentage of the population is affected by this, he actually found that it was much higher than we think. The other thing is that what happens is that a lot of times practitioners don't really know if an individual is obstructed or not because we look at structurally what the glands look like. And a lot of the times, if we see on mybography or structural evaluation that there's a lot of glands intact, we often assume that, well, they can't be obstructed. So then, we continue just with our normal traditional ways of treating them. But then you have these patients that will go through rounds of thermal pulsation or IPL and they still won't improve. And then you wonder, well, what's going on here? And a lot of the times, probing can also offer a diagnostic ability for our patients because then you're able to essentially find out if they are obstructed through probing. Another way of also finding out if they're obstructed, which is not really available readily in most practices, is confocal microscopy. And so, confocal microscopy is in larger academic centers and larger, more advanced clinics. And oftentimes, even in those centers, they're not really doing confocal microscopy on every single patient that's walking through their door, to look for this periductal fibrosis around the glands. And so, in those patients that were not responding to the conventional and traditional treatments, I would start to introduce introductal probing. And what I found is that that was essentially a game changer in my dry eye practice. These individuals not responded to any other treatments before were now starting to obtain dry eye relief.
Wow. So finding these candidates then, are these kind of like when you're making that diagnosis and whether you're doing, probing as a treatment or kind of diagnostic, are these candidates that have been through treatments and then you kind of take the next step, or now that you have more experience with it, like are you looking at like a mybography scan, right, and being able to kind of, or even behind the slit lamp being able to draw a different conclusion? Like, how do you initially identify those candidates? Is it just those that have been through the treatment?
There's a couple of, I would say, factors that are involved. Definitely where they are in their dry eye journey is probably at the top of the list in terms of where I'm going to start them off in terms of therapies or treatments. And so if they have, exhausted several other different in-office procedures or modalities, then the next step would be probing. The other thing in terms of looking at diagnostics, whether it's structural analysis, the other one is definitely functionality. And so the big one that I use is just grading the expressibility and quality of the glands. And I really always turn to the International Workshop of Meibomian Gland Dysfunction because it gives you a grading system. And so if I find that these individuals, are not expressing really well, in addition to having like other factors such as an increased amount of like elevated pressure within the lids, so they're experiencing some pretty significant lid tenderness. And then the other one is if they have a significant amount of structural loss. So all of that together will lead me sometimes to start with probing first versus later if I'm seeing multiple factors that have elevated, I would say, the severity of their disease process.
Okay, I was wondering like how you're choosing your patient for this, and in my experience, I haven't ever felt like I feel like this person needs probing, and part of that is probably just because I don't really know that much about probing, and I'm not that familiar with it. But sometimes there is this patient, and Jessilin, maybe you've seen this too, where someone's glands look really good on mybography, but as you examine on the slit lamp, you're pushing on their lids and they're obstructed. So then I do, let's say I'm doing thermal expression on this patient. And as I'm doing that thermal expression, I'm like, well, where's all the oil? Like, I should be getting more of this oil. This is a really long gland. I'm getting just a little bit. And then that's the person where I'm like, oh, I wonder if there's fibrotic tissue deeper in this gland, is why I can't really get that oil out. I don't feel like I come across that all that often, but I feel like that's probably a really good patient for for meibomian gland probing.
Absolutely. That's the patient where if you grade them based on the expressibility and quality, they're probably going to, on the expressibility scale, it goes from 0 to 2. They're probably going to be a 1 or a 2, where 1 means they're expressible in 1 or 2 glands in those 5 glands, or 2 being they're not expressible in any of them. And the other telltale sign is if they complain to you that they do heat therapy at home and it doesn't provide them with any relief or it makes them worse. And so that to me is also a telltale sign that there is potentially further obstructions, because there is a subset of obstructive meibomian gland dysfunction that is partial obstruction, where you might have like some fibrotic tissue that strangled the gland halfway or a little bit, but then you get some oozing around it, but it's not enough to restore stability to the tear film and improve their symptoms. And oftentimes, I'll hear from practitioners, well, their glands look great, right? Like you said on the mybography. But you have to take it one step further and evaluate the functionality of those glands.
Can you talk a little bit about this procedure? Because I have seen patients that have had it, and it seems like patients don't enjoy this procedure. Like they do kind of have to prepare themselves for it, because many patients will say like that it was really pretty painful. So can you talk a little bit about how the procedure is done and the expectations in terms of patient side effect and discomfort?
So we use an 8% lidocaine compounded ointment with jojoba oil based on Maskin's recommendations, because the jojoba oil allows the lidocaine ointment to penetrate deeper into the glands. A contact lens or a corneal shield is placed in the eye to protect the cornea from the lidocaine. And then the ointment is lathered along the lid margin, lower and upper lid. And then it sits there for about 15 to 20 minutes to allow as much penetration as possible into the glands to try to alleviate discomfort. And despite that, patients still do feel it, especially if you're using a longer probe. So typically, if you're using like a 1 millimeter probe and they're numbed, they don't really feel all that discomfort. But the 2 millimeter or 4 millimeter probes, which penetrate deeper into the gland, and jojoba oil with the lidocaine ointment does not penetrate as deeper, can definitely create more discomfort for the patient. So it's not the most pleasant. And a lot of times, these patients, like you say, they do have to psych themselves up for it and prepare themselves for it. But believe it or not, the majority of patients are so readily compliant with the procedure because of the fact that they are so motivated to get relief. And so they understand that this is a short term pain for a long term gain. The other part is adjusting patients' expectations, understanding that you're not going to walk out or wake up the next morning feeling like you're cured or you're 100% better. There is a process to meibomian gland probing. There's two parts to it. The first part is if an individual has an elevated amount of pressure and they feel lid tenderness and pain, that usually ends up being relieved almost immediately. But then there are other dry eye symptoms like the watering, the burning, the discomfort. Those take longer be to be alleviated and subside. And they can usually take anywhere from 2 to 3 months before a patient starts to really feel the effects of it. And the postulation surrounding that is that there's the hypothesis that some reepithelialization, some ductal cell proliferation, and stem cell regeneration occurs, and that process takes a while. And so this is where, which is also a little bit controversial, but the possibility of some regeneration of atrophied glands comes into play, right? Because that regeneration doesn't happen overnight, and it does take some time for the glands to regenerate. And so what we find is that we adjust patient expectations. That a lot of the times they're going to feel worse before they feel better, and we let them know that it's going to take approximately 2 to 4 weeks to even return to their baseline. And then after that, it's going to take at least 6 to 8 weeks until they start to feel the improvements and the effects of probing.
Yeah, it's awesome to be able to have that tool to give patients relief, right? Give them options. So you do this treatment procedure in the office and then you send the patient home. Are there any like post-procedure instructions? When do you see the patient back? Because obviously it takes a little bit time. So what do those next couple of months look like for the patient in your office?
So it depends on their journey and where they're coming from. And if it's like an individual that has been referred from another office, I usually will send them back to go get a follow up IPL in about 3 to 4 weeks, because studies have shown that following up with IPL after probing actually enhances and improves the efficacy of the probing procedure.
Yeah, there was that 2019 paper by Dr. Hong that looked at comparing just MG probing versus just IPL patients. And the patients that had both definitely have the better outcome. So it's always nice when we have some real, real scientific data to kind of back that up.
Absolutely. And then the other part is that if they um, have never had any procedures or they've had some, but they didn't work, now that the glands are unobstructed, we will follow with IPL.
Mhm. How often does a patient need to have this repeated?
Rarely do I have to reprobe an individual patient, actually. I would say I have about only a handful of patients that need to be reprobed on like an every 6 to 8 months or 1 year basis. I find that I'm able to keep them going with maintenance IPL every 6 months or every year, and they do fairly well. The individuals that I find that need to be reprobed the most are those that suffered from obstructive meibomian gland dysfunction as a result of Accutane use. Those are the individuals that, for whatever reason, and I can't explain it, despite being probed once or twice, their body still forms scar tissue once again. And those individuals need to be probed on a little more frequent basis. But I'm finding that as we move to stretch the period between each probing session, they're still finding now longer and longer bouts of relief. So, hoping to get these individuals in a place where they're not having to get probed every 8 months or so.
And you're probing lower and upper, right? You do both?
Yes. And the reason for that is that I truly feel that in these patients who just have such a heightened symptom profile, you need to be able to maximize the functionality of as many glands as you can. We have just always traditionally focused on the lower glands because of the mechanical way of how we blink, right? And thinking, oh, we don't see as much structural loss on the upper ones. But in these patients that end up having so much of an increased symptom profile, they need as many glands as they can functioning in order to restore their tear film stability and improve their symptom profile.
You mentioned Accutane patients, which definitely makes sense. Have you seen any other kind of common factors among patients or other risk factors that makes them a little bit more likely to have, that kind of scarring, that fibrotic obstruction?
I would say patients with autoimmune conditions, I think their body just, wreaks inflammation all over. And that ends up, having a heightened inflammatory response within the glands. And I think chronic inflammation ends up then leading them to forming that scar tissue.
Can you talk a little bit about the equipment that you use? Is this like a single use, tube that you're using? Do you sterilize? Like how does that work?
It's a single use. And oftentimes, depending on how much scar tissue or keratinization there is, we may need even to use more than one or two probes in one session. The other part is that, when the probe is inserted into the gland, if it's not inserted at the correct angle, it will hit the duct wall. And so what happens is that, if a practitioner who is maybe not as experienced with probing, continues to hit that duct wall, that probe will just break. And so the reason is that the gland is like an artery or a vein. So it's spongy tissue, and when it hits, it compresses or expands. And that's why, controversial as it may seem, probing is really not harmful to the glands, because what happens is that probe is so thin in diameter, and it's just not able to pierce that duct wall. And so, even an inexperienced practitioner attempting probing, they are not able to actually break through and pierce that wall. The probe is just not strong enough. So, what ends up happening is the probe just breaks. And, as I would say at the beginning, I used to use multiple probes on one patient because I was, breaking multiple. And now I usually will maybe use one or two at most, but it is a single use, and every patient gets a brand new probe.
One question I had about probing is, and just this is, I'm sure will tell me that this is probably incorrect thought process, but my thought was that if we're putting a probe down there, could we also then create more fibrotic tissue? Like, are we irritating the gland by sticking a probe in it? Like, does that have a reactionary, um, you know, problem where we just have now more, are we creating fibrotic tissue? I'm sure the answer is no, but that was my thought process in probing. Like, well, there's fibrotic tissue there, and then we stick a probe in it. Is this going to irritate the gland more that we're agitating it?
Yeah, and there's definitely, I think, a lot of individuals who have the same concern. But if we think about the anatomy of the secretions of the glands and the consistency of the gland secretions. So typically, our meibum is supposed to be mostly omega 3, olive oil, transparent, liquid at room temperature. But in our patients that suffer from meibomian gland dysfunction, the ratio is skewed more towards omega 6, and that's why it's solid at room temperature. So when you pierce through that meibum that is like that, imagine piercing through a block of butter and then just, putting the knife in, putting it back out. What happens to the block of butter? It molds back into that shape, right? And so we really don't have to worry about harming or damaging because of the consistency of the meibum secretions.
This has been eye opening.
Yeah. So are there, I guess, like side effects or things that could go wrong, to educate patients on of even if it's rare, run us through the list of just kind of like what to possibly expect with that.
So the biggest side effects are, if you have any bleeding or hemorrhaging at the gland orifice, which can occur because oftentimes if there's like inflammatory vessels that are wrapped around, that could be scary. But typically they coagulate so fast and it's not lasting. The other part is that an individual can have like an allergic reaction to the numbing agent or the jojoba oil. And oftentimes that's mitigated by, an antihistamine. We also will always prophylactically treat with a combination antibiotic, anti inflammatory drop just to prevent any possible infection and lower the inflammatory load.
That makes sense. Where does one get this jojoba oil at? Is this like, so is the lidocaine cream you mentioned was compounded, but like where do you buy this? And do you mix it like a little concoction or do you apply one first and then the other?
No, it comes together. The
Okay.
pharmacy compounds it for you.
Oh, awesome.
So, yeah, so you just write the script to your compounding pharmacy and tell them that this is what you want. In the United States, the pharmacy that does it is, I think it's called Brian's Pharmacy, and they will ship it to anywhere in the US for you.
Is this, so I know you practice in Canada, but you obviously have a lot of experience. Is this kind of an in-office procedure that's typically like a self-pay? Have you seen, probably depending in North America where you're at, any sort of coverage? What does that part look like for patients?
Yeah, it is a private pay out of pocket expense. It's not covered by any insurances that I've seen here in Canada. And my experience is that it's also not covered in the US as well. We do see more and more patients utilizing like HSAs or FSAs to cover their expenses. But as it comes to insurances or government coverage, we haven't seen any coverage.
Raina, this has been so helpful and educational on Meibomian gland probing. You answered, I feel like, a lot of the common questions that I hear when I talk to colleagues about, incorporating this in their practice, and does this really work, and what is it like? So thanks for giving us a really great overview of that. We can't wrap this podcast unless we really ask you about your life lens. So what is something in your life that you really appreciate, love, has made your life easier? What do you have for us?
So my life lens is about perspective. And it is because oftentimes we don't realize that if we just change our perspective, things would really get a lot easier. And so my perspective comes to when I think about control. You cannot control other people, their feelings, their reactions, or their actions. But your perspective should change so that you can think that you can only control your perspective and your actions and your feelings and your reactions. And I think when you change your thinking to that and start to work on how you see things and how you act towards the things that come at you versus expecting others to, it really is liberating.
I like it. Words of wisdom.
I
How
do too. I
inspiring.
love it.
That is really good. Really good. Well, thank you so much, Raina, for being here. I feel like educational on all fronts and inspiring on many levels. If our listeners wanted to follow up with you or had more questions, how could they connect with you?
They can definitely reach me on Instagram. My handle is iDrTaji, so just EYEDRTAJI. Our clinic website is www.torontomedicaleyeassociates.ca. And then they can hit me up on LinkedIn, Facebook, but Instagram, usually I'm happy to answer any of our colleagues or clinicians' questions and happy to assist.
So, Raina, I know you have something really exciting happening in your practice. What's going on? Tell the listeners.
Right now, we're in the process of renovating a new space. It's going to basically be our whole dry eye clinic. Plus, we're going to be expanding into a little bit of a teaching facility so that clinicians and practitioners who want to experience hands on training with such things as meibomian gland probing will have the ability, to come learn it, to come do it, and to really get comfortable to be able to take what they've learned back into their practices.
I love that.
I know. If somebody wants to do that, they reach you on Instagram, same way as we already talked about.
Yeah, so they can reach me on Instagram. It will be running hopefully in the new year. So look for it come first quarter.
Thank you so much. This was great.
Yes, thank
Thank
you.
you. Thank you both for having me.